Anatomy of female sexual pleasure. The female pelvic anatomy continues to be full of fascinating mysteries related to the stimulation and identification of pleasure zones and the possibility of having orgasms. Knowledge of female sexual anatomy facilitates the understanding of zones of sensitivity to pleasure. This knowledge helps to achieve greater levels of satisfaction and, in many cases, facilitates the possibility of having orgasms. The sexual act and pleasure zones. This animation shows a sagittal cut where the location of the penis can be seen at rest in a coital relationship in the missionary position. See the direct relationship between the points associated with zones of high sexual sensitivity and the points where a point of friction is generated between the penis and its base with the vulva. The contact points of high sexual sensitivity are all located in the first third of the vagina. They are largely related to the angle and position of the penis in front of the vaginal opening. The other two-thirds of the vagina are not associated with feelings of sexual pleasure. Likewise, it can be observed that the length of the penis does not have much incidence on the female sexual response, since in a strictly mechanical sense, the length of the penis does not directly affect the zones of high sensitivity to pleasure. On the other hand, the thickness of the penis would directly affect excitation, as a greater thickness directly affects the pleasure zones. Surgical procedures associated with functional molding for vaginal narrowing seek to increase the sensation of friction in these pleasure zones, generating a narrowing of the first third of the vagina, seeking greater sexual satisfaction for the woman by having greater friction. The clitoris. The clitoris and other organs associated with the sexual excitation phase. The clitoris has the sole function of providing sexual pleasure to the woman. It is as essential for a woman as the penis is for a man. The clitoris is made of the same tissues as the penis and for the most part functions in the same way as a penis when it comes to sexual stimulation. Some clitorises are as large as a small penis. The main parts of the clitoris. The three main parts of the clitoris are the glans, the foot of the clitoris, and the shaft or body of the clitoris. Immediately before a woman's orgasm, more blood accumulates in the body of the clitoris, creating a firmer erection, which causes the glans to move toward the pubic bone. This erection gives the impression that the glans is retracting under the prepuce, when in reality what it is doing is straightening as a consequence of the concentration of trapped blood. Clitoral erection in the excitation phase, frontal view, and clitoral erection in the excitation phase, lateral view. These animations visualize the details presented in the description of the vulvovaginal reaction to sexual excitation, where the process of clitoral erection and widening of the vestibular bulbs can be seen. There is an increase in the blood supply to the entire bulbar area and the base of the urethra. According to the bibliographic reference of the Atlas of Human Sexuality presented at the end of this video, a relationship of response to greater sexual excitation can be established depending on how close the glans of the clitoris is to the urethral meatus. The conclusion reached after a significant sample of analysis among more than 200 patients is that patients in whom the distance is less than 2.5 centimeters always reach climax during intercourse. It is worth noting that with a clitoral urethral meatus distance of less than 2.5 centimeters, greater sexual satisfaction is presented. The clitoris and the main veins, arteries, and nerves of the pelvic cavity associated with pleasure. The glans of the clitoris has as many nerve endings as the glans of the penis, only in a much smaller area, which makes it extremely sensitive. The nerve endings of the glans of the clitoris are around 8,000, and the endings of the glans of the penis are around 4,000. Main nerve zones associated with pleasure. In this animation, the areas painted pink, known as the mons pubis, are the upper part of the labia majora. The ilioinguinal and genitofemoral nerves innervate this area. The posterior femoral cutaneous nerves innervate the femoral regions painted yellow. The pudendal nerves innervate the rest of the vulva and the perianal skin. Zones of high sexual sensitivity. The nervous system of the vagina is not the same throughout its course. The first outer third of the vagina is part of the somatic nervous system, while the inner two-thirds are part of the autonomic nervous system. This means that the outer third of the vagina is sensitive to a variety of sensations, yet the interior of the vagina is mainly sensitive to pressure and pain. The most complex area of innervation is probably that of the periurethral glands, which in much literature is associated with the so-called G-spot, since the nerves of the vagina, the clitoris, and the urethra